Michael is a health communications consultant, journalist, and he spent 30 years reporting on advocacy, writing about advocacy and community issues across Colorado. So, Michael, thank you all.
Thank you, Karen, and thanks to the foundation and all the organizers for this chance to broaden the conversation between journalists and the people who are working hard on addressing all of these issues that have been raised about the social determinants of health, and in particular, housing and its relation to all of the social determinants of health that we'll be talking about today. Remember that you don't have to start filling out your sabbatical applications right now. If you could hold that off till later. There's a session at 11:30 with Karen to talk about that, but I know it's a huge, exciting opportunity. Why do we want to talk more with journalists today about the social determinants of health and the housing issues in Colorado? That came up a lot yesterday in terms of why it's necessary. There are facts and then there are stories, and they're both hugely important in getting this point across and in getting change to happen. One of the things I really appreciated about yesterday's conversations was it talked about, we know that change needs to happen, and here are the problems. How do we get change to happen? The way you get change to happen is you talk to the policymakers who can make the change happen. You can talk to legislatures who can bring in new laws, city council members. You also need to talk to voters who are going to approve or disapprove a tax increase for affordable housing, or a latest school bonding issue that makes a school district more livable for the people who are looking for housing in those districts. And the people who are going to be telling those stories and synthesizing those facts, going out in the community, talking to every different community, and learning what the issues are and listening, are the journalists who are with us today and the journalists who are working every day throughout Colorado. So that was the idea in bringing them here today. And for you to talk to them and bring in your questions about how they can do their job better, what you can do to help them, what you can bring to the table with them in terms of facts and figures and stories. I wanted to start with two very quick stories today that I've found in my reporting that talk about, yesterday there was a lot of talk about the mechanisms. It's one thing to just sort of show up and say, wow, these people are in a bad situation. It's another to observe, as Marissa did and Matt Iglesias did and a lot of other panelists yesterday, to say, what are the mechanisms that were official decisions were made and institutional decisions were made to take things away from people or put them in that position. I want to share the story of Andrea Fuller's family, who have lived in a Denver apartment building, a very modest Denver apartment complex, for 11 years. We've talked about the idea of a house is not just a house, it needs to be a home. One of the things that makes a house a home is safety and a safe environment. And they wanted to move to another apartment in the same complex because garbage wasn't getting picked up in their part of the complex. There were other issues with their own apartment. When they applied to move to a new apartment, they were asked to pay a new deposit, even though they've been paying rent at this place for 11 years. They are asked to pay a transaction fee, which they still don't understand what the transaction fee is. They are asked to pay a paperwork fee. The total of all these fees was going to be more than $1,100. And we have talked, a lot of the people in this group have reported about the fact that 40% of Americans don't even have $400 in an emergency fund to pay for contingencies like that. They are being asked to pay $1,100 just to transfer to a place they'd already been paying rent to for 11 years. When they got to their new apartment finally, they found that there were no batteries in the smoke detectors. The washing machine didn't work for the first 7 weeks that they lived there. Oh, and the heat didn't work either. So there was no heat in their apartment. So that's the kind of official institutional decisions that are made for them by the apartment owners that have been changed, thankfully, this year by some new legislation that requires that apartments provide a safer environment, that landlords have more responsibility, and that renters have more access to change that situation. But it's a very difficult thing to do. They felt they had no power in this situation. And I want to bring up another family we've talked about. Trailer parks get a bad name. They're the butt of a lot of jokes by journalists, by policymakers, by late night talk show hosts. But there's another term for trailer parks. It's called affordable housing. And we talked to a family who has been living in Denver Meadows. They had moved here from Missouri, Shannon Holloman's family. They were paying $500 rent. I don't know if you know how trailer parks work, but usually you own your actual trailer, your home, and then you pay rent on the spot to have the spot hook it up to water and other utilities. So she was paying $500 for her family in Missouri. Not quite as hot a housing market. When they moved to Denver Meadows, they were asked to pay $890 for their parking spot, which was a big stretch for them because they don't have the highest paying jobs in the world, but they can make it work. Then the owner of the trailer park let people know, after things have been deteriorating for quite a while in terms of conditions, that the place is going to be redeveloped into apartment buildings, golf course, who knows, whatever the demand was for. And so they all had to get out. They all had to leave. She looked around for her family, and the cheapest pad that she could get to park their home anywhere else in the Denver metro area was $1,300. Another huge stretch for their family. They could have moved to Grand Junction to find a cheaper place, but then what's the job? Job market is not quite as hot in Grand Junction, and they weren't sure they were going to be able to get the job that would then pay the cheaper rent there. So they were just faced with this decision that they were going to have to leave and didn't really know what they were going to do about it. And this is in the city of Aurora, where their own housing reports show that they're among families that are making $25,000 a year or less. There's a deficit in Aurora alone of 14,000 affordable housing units. And all over the metro area, trailer parks are getting zoned out or developers are redeveloping them. And policymakers and local city council people have finally realized that maybe they need to do some support for mobile home communities in building co-ops, creating alternatives for people to stay there instead of having them all be redeveloped and get out of the way. And it's a positive development, but it's another way to think about affordable housing and needs to be reported on more. The Aurora City Council person who was trying to help them is herself Hispanic, first-generation college graduate who had grown up in a lot of rental housing throughout East Denver and Western Aurora, and had to move a lot for different reasons, facing rent increases. And she just said that in working on situations like this and other constituents, that she's still facing thousands of people every month who are facing the choice between rent and food. And the way she put it was, I can't believe that as a developed country, we're still having this conversation. But we're having this conversation every day, as we proved yesterday and will prove throughout today. Today with us, we have Tina Griego from the Colorado Independent. Tina, come on up. Alycin Bektesh from Aspen, who has done reporting up there for the papers and also moderated panels for Aspen Public Radio about public housing in particular and people's housing issues. Markian is with Kaiser Health News as a new addition to the Colorado scene and have done a lot of reporting in Oregon on the social determinants of health and health in general. And he's going to be working for Kaiser Health News, which now has a bureau in Denver, in case you guys hadn't heard that is being funded by local foundations, including the Health Foundation. So, some welcome new firepower on the local health scene. Jakob Rodgers from the Gazette in Colorado Springs, who reports on civic issues there and as they especially relate to housing issues and has worked on some interesting issues with a recent housing project there. And Ruben Gallardo, who is joining us from some work he's done with Out Front. And Out Front is one of the leading gay and lesbian publications in Colorado working on those specific issues, and he's done some interesting reporting recently on housing issues among that community. So welcome all of you. And just to go with the format for a minute, we're going to talk for about half an hour amongst ourselves. Then with your input, we have index cards on the tables, as we always do. The veterans here know how this works. Write down your questions, your comments, things you'd like people to address. If you have a specific person you'd like to address it, that's great. And pass those down to the end of your table. People will come around, grab those questions and sort through them. People who are watching on the live stream can please add your comments to the live stream on YouTube or send in your questions by Twitter, and people bring them up, and we'll get those in the last 15 minutes. So I wanted to start with Tina. Tina, you've spent a lot of time in Sun Valley, among other Colorado communities, writing about issues such as gentrification, the city's involvement in changes that are going on in Sun Valley for better and for worse, and whether residents felt that was for better or worse. Love for you to introduce to this group, not all of whom are from Denver, about what Sun Valley's place is in the metro community and what its place is in the Hispanic community, and what's been going on there in the last 10 years in terms of trying to change that community and how people who've lived there a long time feel about it.
And how much time do I have?
Minute and a half.
All right. Good morning, everyone. I'm really happy to be here, very excited. It's a little bit like being a kid in a candy store to be in this room, because I look out at all of these faces and all of this expertise and passion and devotion, and I see stories. So thank you for having me here. So Sun Valley is located south of the Bronco Stadium. That's probably the most notable marker of it. It's past that vast ocean of parking lots. It is in a natural kind of gully. And back when it was established in the late 70s, the Platte River was basically a sewage line. It was behind the railroad tracks, so you had tracks, Platte, Xcel Energy had, and still does, tanks, big giant tanks there. And so, and then on the west side of it was Federal Boulevard, which rises high. So if you're on Federal, there's a line of buildings there. You actually can't see into Sun Valley. It has natural and man-made barriers. On the south is an industrial belt. It was once a Jewish neighborhood, and then as people became economically more sufficient, they started moving up the hill into Colfax, into West Colfax. When I started working on Sun Valley, I actually really didn't even know whether I should call it a neighborhood, because it's really a kind of government construction. It's almost all public housing. There's about 1,200 residents there. Depends if you're using the official count, which is always an undercount, or how many people are kind of moving in and out of Sun Valley. I want to say it's already been 7 or 8 years back, the city has been talking about what are we going to do with this concentrated generational poverty that exists in Sun Valley. And it had models from other developments it did around the city. So basically the model is to do mixed income development there. And they've raised the first units, and their people were allowed to relocate within Sun Valley or to take a Section 8 voucher and move to another unit. The idea is to minimize displacement. Those public housing units, the count, which is around 330, they will stay there, but the neighborhood is going to triple in density as they bring in mixed income. It is a very deliberate, intentional plan to try to change a neighborhood, to bring mixed income into the neighborhood without displacement, to give people who live there a say in what this place will be, what this community will be, to benefit from the changes, to give them work, to actually create something that I don't really think exists in Denver anymore. Mariposa, which is across the railroad tracks, is very close. But one thing that Mariposa did is that when they put that investment in there, it changed the neighborhood around. It helped speed the gentrification around that redevelopment, which is also mixed income. That's changing for Sun Valley.
So Tina, in terms of the city helping with Sun Valley or other institutions, one issue has been, do they come in and say, you have problems and we're going to fix it? Or do they come in and say, what do we want this neighborhood to look like? What do you want this neighborhood to look like? What are the challenges that you face? And how can we help you address it in the way that you want to? I'm just curious whether the institutional approach was any better than it has been for the last 50 years.
I actually think it was.
Okay.
So I was there for a lot of those conversations. I spent about 2 months in Sun Valley writing this story, in which there was very deliberate attempts by the Housing Authority, by various foundations, to kind of come in and to bring the community together. This is a very difficult community to organize for a number of reasons. One is there is a historical and not undeserved distrust of government. And so anything that the city comes in and says, this is going to be better, they're going to say, for whom? Because I'm not sure this is going to be for me. I face the same distress going in too. And so, I'm sorry, that was one reason. The second reason is Sun Valley is almost all kids. And so besides the children, there are adults, and then there's a constant churn. So you have people who are leaving and coming and leaving and coming, and it's very difficult to get people on the same page. But there were numerous attempts and meetings over the years, and they continue, and there's some changes that have happened to try to ensure that the people who live in Sun Valley through the years, again, because the population changes, have a say in what Sun Valley becomes.
So let's talk about the reporting aspect of that quickly before I move to another person. Was it hard to get people to share their stories with you and share their emotions with you and gain their trust so that you could, and then who did you feel you were trying to communicate that message to in your reporting?
Yes, it was very hard. Something Karen said last night after the film and that very intense, profound discussion that happened after the film, she talked about the idea of going to activate community voices. At the Colorado Independent, which is a nonprofit, we talk about amplifying voices. In that we have to be careful how we say that so that the burden is not on the community, that those voices have always been there, and that there have been systems of exclusion, and those systems of exclusion have to be called on the carpet. The media is one of those. We have been part of the problem. We have been gatekeepers. And so when I go in there, I'm actually seen, when I first went there, I'm actually seen as an arm of government. And they see no reason to talk to me. And also, there has been a historic propensity by outsiders, including the media, to define communities like Sun Valley by their deficits. And no community wants to be defined solely by its deficits. There is a blindness to the assets that exist there. And so I had to go in and talk. Well, basically what I had to do is actually go in and listen. Let me correct myself. I had to go in and listen, and listen, and listen, and listen. And I went to a lot of meetings, I knocked on a lot of doors, and eventually I became a little bit of a fixture around there, and that's how I started to gain access and trust. And so
And that's a great point, that journalists see themselves as fighting the man, in quotes. We're there for the people. And don't realize that when we walk into situations of people who have different experiences, we are the institution. We have a big publication, we have a big staff, we come from certain educational backgrounds, and we're a lot more like the government institutions that are suppressing them or not addressing their needs than we are like them.
That's
so
correct.
It's important to remember. Jacob, if you could talk a little bit about some reporting you've done recently. There's a new housing development in Colorado Springs that you've written about that is aimed at a specific population that's had difficulty in finding housing, let alone a home. Talk a little bit about what you've been working on there.
Yeah, so down in Colorado Springs, there's a nonprofit down there. They've been really working for the past several years to improve a lot of the foundational sort of services that are available for people who are experiencing homelessness. The Springs is pretty behind the times in terms of support for the homeless population. About 20 years ago, a project that would have really boosted shelter just really faltered amid a lot of community backlash against it and resistance. So it's only been in the last 5 or 6 years that we've really seen, again, a concerted push to improve just even baseline shelter. And so they've really been building a lot of shelter, and they've created a big campus, much in the same vein of like San Antonio, Phoenix, that sort of thing. And while they were building that campus, they decided to build a apartment complex. What they did is they applied for low-income housing tax credits, so they got the 9% funding model out of that, and they built a 65-unit building that just opened up. They've been replacing residents for the last 3-4 weeks, and so I was able to have a chance to talk to a lot of the residents in there. What it is I mean, essentially, this is a pretty much a completely permanent supportive housing building. Every person in there receives a housing voucher, a federal housing voucher, and which includes a lot of wraparound services. They all get a case manager. They all get access to medical care, to mental health care, to substance abuse treatment, better access to VA help, DHS, even just the simple task of trying to get an ID for a lot of people who are living on the streets is monumental. And when they get an ID, usually it's stolen within a week or so. So it's what it's intended to do is essentially kind of continue that housing first ethos that we've seen many other places across the nation. Colorado Springs has been, again, a little bit behind the times in terms of building that out. We've already had several vouchers and a program like that in the Springs, but this is the first major expansion of that we've seen in quite a while there.
What did you feel were your challenges in understanding the group that you were talking to, their individual challenges, but then also talk a little bit about who did you feel your audience was? Who were you trying to tell about this aspect of homelessness and housing challenges?
Yeah, good question. So basically, I mean, for the first part of that, trying to get the stories of the people who are living there, I've been fortunate. I've been able to cover this area for the past 6 years or so. So I've already spent a lot of time, walking in the camps and at the shelters, trying to meet as many people as I can. And so I already have a bit of a rapport with many of the folks who have been homeless for many years. I mean, I think the biggest thing though is that it's really fascinating how so often people who are homeless want to actually just tell their stories. I think there's kind of a hesitancy amongst many of the nonprofit leaders that I talk to kind of protect the people who they're serving, which is natural, and oftentimes it's I understand. But I think that more often than not, I mean, usually I just say, hey, how's it going? Shake your hand and start talking, and they'll just start gushing. I mean, sometimes it takes a few questions to start getting going, but they've been ostracized by society for so long that when someone actually takes an interest in their story, they want it to be told, which is cool.
Are there gaps between what your readership thinks they know about what brings people to homelessness and what addiction problems are, what these questions of racial inequity in housing versus what conversations you actually have with people who have experienced homelessness?
Yeah, definitely. I think, the whole model of providing housing first, and then, once you after providing that stabilization, that foundation, then addressing getting a job, treating an addiction, that sort of thing. I think there's still quite a bit of hesitancy, a lot of skepticism and resistance in the community about that. And so, basically, in writing a story like that, I didn't even get really into the whole LIHTC financing model, which is brain damage to begin with, but essentially just trying to offer more of the human perspective was the goal with that. And I think that that's oftentimes in trying to cover homelessness, that's what I think is most important, is trying to offer the human stories of what's actually happening, so that people can actually see a lot of times they aren't that far away themselves from homelessness, or they see a relative who could very well be in that same situation. Because I think, that there's still quite a bit of a gap there in that understanding. Yeah.
Ruben, if we could talk, do you have the microphone there? Great. A little bit about your reporting recently for Out Front about another specific group, and some of even though they're a group, they all bring their individual stories to the situation they found themselves in. But talk a bit about the housing issues that face lesbian and gay community in Colorado, and where you see that going for them in terms of public understanding and the role that you can play in telling people about that.
Right. So first, I would like to talk about my inspiration to decide to pursue this topic. So back in the fall, I was listening to a podcast, and it kind of gave a general overview of the housing crisis. And one of the guests, they briefly mentioned that LGBTQ individuals are usually disproportionately affected by the housing crisis. And this has to do with the rampant discrimination that still occurs in the home and outside of the home. So that's when I decided to pursue the topic and see how it's affecting people, especially in the Denver metro area. So for my article that I wrote, I talked to 3 organizations that are providing services to these individuals in the Denver metro area, and this includes the Gathering Place, which is a daytime drop-in center for unaccompanied women and transgender folks, the Dolores Project, which is a shelter, and they also provide supportive housing for unaccompanied women and transgender folks. And finally, I spoke to Urban Peak, which I believe there's a representative here in this conference who will be speaking in some event later. And they provide services to youth ages 15 and 25 in the Denver metro area. And when I was speaking to the directors of these organizations, I found the reasons why young people, and especially LGBTQ individuals, are most affected by the housing crisis. So when I was speaking to Christina Carlson at Urban Peak, she mentioned that there's 3 major predictors for youth who are at risk of experiencing homelessness. The first predictor is family instability, followed by involvement in the juvenile system and the welfare system, and that's usually referring to the foster care system. And finally, the third major indicator, predictor, it's individuals that self-identify as LGBTQ. And once I kind of heard these stories from these directors and from my own research, I also found some interesting statistics. And based on the research that is being done out there by organizations that are trying to address this problem, they estimate that about 7% of the general youth population in the US identifies as LGBTQ. However, about 40% of the youth population experiencing homelessness in the US identifies as LGBTQ. So these major predictors and statistics just kind of tell you how this marginalized community is usually more affected by the housing crisis. And the reasons for that is it usually has to do with family conflicts. So one of the most common factors that is cited out there by individuals who have experienced homelessness in their younger years is that when they come out to their families, they may not be accepted by their parents or whoever they're living with, and this can create a hostile environment in the home. And worst case scenario for them, they may be kicked out of their homes because their parents or their family doesn't accept them for who they are. And in addition to that, even if they're not kicked out of their homes, they make the tension between them and their family may create such a hostile environment that it forces them to run away. So this is the reason why we're seeing those statistics out there. And
there's another group, even when you are of age, there's another group that is rejected by apartment owners or apartment managers who just, whether overtly or just by never giving a reason why they're rejecting the application, make it clear that they don't want people from that community living in their apartment.
Yeah, so it's interesting that you bring that up because right now in the US, it's still not explicitly prohibited to discriminate on the basis of sexual orientation and gender identity. So right now, there's about 5.6 million adults that ages 18 and older in the US that identify as LGBTQ who live in states without explicit statutory protections against discrimination in housing. In addition to that, there's some great research out there being done by the Williams Institute, which is a think tank at UCLA Law School. And they recently conducted a survey back in November 2018 where 15% of the LGBTQ people who responded said that they were denied housing. And in comparison, only 6% of their heterosexual peers were denied housing for whatever reason. So the fact that it's still not illegal to discriminate against sexual orientation and gender identity, even though we have gay marriage, doesn't mean that these individuals are facing further obstacles when it comes to housing and when it comes to, kind of being involved in the economic spectrum.
We can certainly imagine people giving talks at the conference 10 or 20 years from now, looking back, and it feeling like people's reaction to Maris's conversation yesterday about ethnic discrimination, racial discrimination, and what that felt like, and hoping that between now and then there's more protection available and the practices are different. I hope that people are prompted to ask more questions about that. Alycin, I wanted to get to another part of the state geographically. People's assumption is it's a different part of the state economically as well, but there are huge economic challenges in Pitkin County and in the mountain communities in terms of housing, and you've covered them quite a bit. I'd like to hear a little bit about what you've been working on lately in terms of affordable housing challenges and just trying to find, there are a lot of $20 million houses in Aspen. There are also a lot of people who are working there for minimum wage or just above to do all the service work for people who are living in the $20 million houses. So tell us about those conflicts and what's going on right now in terms of trying to solve them.
Certainly. I want to start by echoing Tina and say that I'm thrilled about who's in the room. I do cover housing in Aspen, which is to say I'm a general assignment reporter. There's nothing that touches our community that doesn't come back to housing. I also produce the radio series leading up to the Aspen Ideas Health program every year, which is global health. So I don't know if I'm more excited to talk to you guys about health or housing, but the intersection is absolutely real. So I did some research real quick on Zillow this week. The cheapest thing on the market in the Aspen area in Pitkin County is $115,000, which is pretty reasonable if you're trying to buy a house in Indiana. In Aspen, that's for 20 days of a hotel room a year. If you want to live in Aspen year-round, the cheapest thing that I found on the market is $250,000. That is a 300-square-foot hotel room. And I saw the statistics, Denver metro area, I believe, Colorado in general, that it would take about someone earning the median wage 20 years of saving, if you're putting 5% of your wages away, in order to buy a house. So that's not going to be $250,000 20 years from now. That's going to be exponentially bigger, of course. Our median home price is $2.5 million, which for math purposes was very easy for me to then do the calculation. If you are earning $50,000 a year in Aspen and want to buy in the free market, it'll take you 200 years to save up. About 5 years ago, when I first started reporting in Aspen, there was a story that a member of our homeless population won $250,000 on a scratch-off lotto ticket. This was national news because he couldn't buy a house in Aspen. And I know that that's the reputation. But I think because we're kind of at that extreme, almost comical level, we can have these conversations a little less personally that are happening with anyone else, right? Because what people said to him is, why don't you leave? What people say to our accountants and our lawyers who can't afford to live in Aspen is, why don't you leave? And that's the same conversation that happens to a homeless population anywhere, right? Like, you're living in Colorado, we have winters, you're sleeping on the streets, why don't you just go? Why don't we just bus you somewhere else? And so it doesn't really matter. We're all human. It doesn't matter if you're working at a nonprofit in Aspen or if you're sleeping on the streets in Aspen. The first question of why don't you leave is insulting on a human level, of course.
And I think this is from one of your pieces that 30% of the year-round residents in Aspen are living in supported housing, are they not? Or price-limited housing?
So I'm going to do my best to not make fun of Aspen, since I'm the one representing Aspen today, because we do have the oldest affordable housing program in resort communities. It's the largest per capita in the nation. So there's a lot of things that Pitkin County got right and early, which is allowing us to house our workforce population. Because we started early, we didn't have a roadmap. There's a lot of things that we got wrong, and so hopefully people can learn as well. We have about 3,300 beds in Aspen that are subsidized by the government. We have a year-round population a little bit more than 7,000. So that is a significant portion of the people who live in Aspen who are not paying free market to either rent or own their home. The conversation that's come up is community housing versus workforce housing. of those 3,000, 3,500 beds, they're not all working in Aspen. Some are retired, some are children, some had a family. They're not even all occupied. Some had a family and got a 3-bedroom house because the people who made the affordable housing system 40 years ago wanted houses, and they built themselves houses. They moved into those houses. They raised their kids in those houses. Those kids have left. Those beds are empty. We have no requirements for those people to move out of their home, and should we? Of course, like, you worked your whole life in Aspen. You can't tell someone to move once you're not work eligible.
Right.
And there's a lot of that kind of conversation, I think, of, in my mind, what I call indentured servitude. If your employer is your landlord, it becomes a very difficult conversation.
Is there an ethnic or racial component to some of the conversations, in that the stereotype or the perception is that people doing a lot of the work involved in housekeeping and cleaning and road work and roofing, things like that, are maybe Hispanic or another ethnicity, and that they need more support and they have to live 2 counties away? Does that come into play in Pitkin County?
Yeah, absolutely. We're 94% white in Pitkin County. It's outrageous. Almost everyone who works in Pitkin County or works in Aspen buses in general, though. Okay. So almost your entire workforce. I told you we're maybe sleeping about 40% of our population. We are housing closer to 30% of our workforce, right? Okay. So 70% of the daily workforce is coming in from the rest of the communities in the Roaring Fork Valley. I think we very much feel like we're all one valley because of that. But yeah, if you are taking a bus, I lived in the Mid-Valley when I first moved to the Roaring Fork Valley, and you're taking the bus. The later home at night you take the bus home, the more other languages you hear. And it is a lot of immigrant population. We rely heavily on J1 temporary work visas in the ski industry, any of you from the mountain communities. But a lot of those people who are coming on purpose for a fun experience of temporary working, they're housed. The Aspen Skiing Company has figured out how to get dorm-style temporary housing. Mm-hmm. So it's not the seasonal workforce that I report on, that I'm talking about as being underhoused, because, but I think there's that sentiment. Well, you just came here to be a ski bum anyway, and ski bum is a career, I would argue, and there's many who are not there for that reason.
Okay. Well, I'd love to get back to any of those issues if people have more questions they want to throw into it, or if you guys want to ask each other questions. I wanted to make sure that Markian talks a little bit about your work in Oregon, but also now starting in Colorado, what social determinants of health issues that you find that you will be covering, that you've covered in Oregon, that may be similar. Portland obviously has its own fast-changing housing issues, among other communities in Oregon. Tell us what you're been working on here and what you've learned so far.
Sure, thanks. I've been in Colorado all of a month, so I can't speak too authoritatively about housing challenges in Colorado, but over the past year in particular, I've been struck in just about every healthcare story that I did in Oregon, how housing played a role. And so I came here with the intention of, one of the projects I wanted to do was look at the various ways that housing affects healthcare. And what's interesting to me, I think it's quite obvious, obviously, when we talk about, the homeless population, and clearly those are the people with the most needs when it comes to housing. But I've been struck about how this challenge affects pretty much every social demographic strata of our society. You see middle-class families now who are paying, $2,000-$3,000 a month for a mortgage, and yet have a high deductible plan of maybe up to $10,000, and they're having very serious discussions at their kitchen table about the trade-offs. If I go to the doctor this week, can I pay my rent next week? We see this with the ability to attract healthcare providers to rural areas. Sometimes they cannot afford the housing. You can find people who are willing to work in those areas, but they don't have a place to live, a safe place to live. So I'm seeing some communities, particularly here in Colorado, trying to find some creative solutions to that. But one of the other things that struck me, kind of the challenge of being a health reporter and trying to report on these issues, is they're so far upstream, and it's hard to it's hard to make the case to your editor sometime that the root cause of this is not X and Y, it's housing or even further upstream. So, I can do a story on Hep A, and my editor will ask, well, what causes hepatitis A? The answer he's looking for is, well, it's a virus that's transmitted through contaminated food or water. But I could also come to him and say, well, it's caused by crowded housing conditions. Mm-hmm. And I can go even further, and I can say, well, it's caused by institutional racism. Mm-hmm. That's a real hard case to make to the editor, that Hep A is caused by institutional racism. But I think that's kind of the challenge that we as the media need to do. I think we're starting to talk a lot more about the social determinants of health, and we're doing stories specifically on that. But when it comes to the specific issues, it's sometimes hard to include those upstream factors in there.
And I think that's a challenge for everybody here who's listening to think about, because yesterday, there's a huge amount of agreement that it's obvious that these things are big and that they come from on top and that we need to attack them at the higher level. And yet an editor's reaction, and frankly some readers' reaction, might be, well, we've been trying to solve poverty for a couple hundred years in this country, if not longer. That's just too big. We can't bite that off in one story, maybe a whole series, but we don't have space for that anymore. If you guys could talk a little bit more about, and we have a question from the audience about that too, well, let's read this. Every time I try to pitch stories to members of the media to amplify, I'm told that my editor will never go for it. So how do we move beyond that barrier? Tina, you play a role as an editor as well as a writer still. How do you guys convince yourselves what to write about? And how do you make something understandable on the individual level, but also at the institutional level?
So that is a challenge. It's a challenge now for different reasons. I mean, one is we have resource questions, right? We have the media landscape in Colorado is drastically diminished the Rocky closed 2009, and the Post has been gutted. We've seen the flourishment of these smaller news sites, but we don't have the capacity that we used to have. So one of the things that I would say is sometimes we get, and I don't mean to turn this into like PR 101, but sometimes we get pitches that clearly they're not at all familiar with what we do. So you're wasting your time and we're not going to do anything with it. What we try to do is, they are big public policy stories, and I think as an editor, we are looking for that entry point in that person or circumstance that can illustrate a larger issue. And one of the challenges that we face, and I was actually hearing it in all of these conversations, is we do get pushback, right? Because a lot of the things that we write, especially if we are focusing on the kind of left behind and left out communities, is that it's really easy for people to push that away and say, well, that's happening over there, and that's happening to them, and what does that have to do with me? And so it's incumbent upon us as reporters to make that connection. So one of the things I look for when I'm hearing these pitches is, what is the way that I can make the connection to the larger community, to the health of the larger community, to say to people, we are bound to one another, and the failure to understand that means we will not progress. It's not okay just to have this pocket of abject poverty in this one neighborhood. It's not okay to discriminate based on sexual orientation. And your numbers, oh my God. So I think that's one of the things that we're looking for as an editor, and is helpful, is like, how can we connect the dots to a larger story, to the larger community? I hope that answers.
Jakob, I was going to ask you, because we have a specific question from the audience that relates to convincing editors, convincing the community maybe. So the audience member wrote that the Gazette is written in a conservative community, at least that's a perception. You're happy to address that if you think that's not fair. Sometimes more socially liberal ideas are necessary to advance issues for less advantaged populations. So how do you at the Gazette handle the balance of tenor between those two in those tensions?
Okay.
Yeah, you're good.
Yeah, I mean, it's a good question. I mean, I think that Colorado Springs is changing a little bit. It's a little more less conservative actually in the city, but yeah, I mean, definitely El Paso County is very conservative, and so I think that I mean, first of all, I mean, I don't let any of that sort of. There is no political sort of infringing upon whatever I write. I mean, frankly, when we're in the newsroom, we're just looking at what's the story, you know, and what are the actual issues at play. Let's just dig into that, and that doesn't come across anything that we're considering in terms of actual coverage-wise. But I mean, I do have to understand the community that I'm writing to, and I mean, for example, like with that apartment complex, I mean, there is often a conservative sentiment that you have to work for what you get, sort of thing, and this notion of a free apartment, essentially, although you do pay a little bit of income, it's anathema to a lot of people in the community, and I think that so. I do try to go about a story knowing that my audience is going to be a little bit skeptical of this idea, and so it just, to me, that only drives home the portion of that I need to really help tell the stories of the people who are actually who I'm writing about a lot better and make it a lot more human. I mean, to the point that we were just talking about, I mean, I think that a way to kind of get my eye on a story a lot better is, all right, there's an interesting issue going on or whatever, but if there's not a person who you know who is affected by it, and if you can help me get it connected to that person, then I can tell the story. Because I just don't think readers pay much attention to a policy story if there's not just a face attached to it. I mean, their eyes glaze over. I mean, my editor's eyes will be like, all right, so what? Well, if there's a person affected, let's write about it. So, I mean, I think that's really the only way that I try and consider my audience is really just trying to, you know, get a sense of maybe what conceptions are out there, and then just tell what reality is. So, yeah.
That leads me to a question that I confront in my own reporting sometimes in terms of telling individual stories that will get people to digest the whole policy story, is the question of fairness and exploitation. How do we tell an individual story knowing that, for example, if we write about someone who is living in an undocumented situation, the first thing we tell them is, please don't read the comments, because the first comment is going to be, go back where you came from, or why are you here? Why are you getting free services? So how do we make sure, and this is a group that we want to talk to about this, because we're often asking people, can you introduce us to someone who is in this situation, whose story we can tell? So how do we as reporters make sure that we do all we can to draw the general public into the story without exploiting the individual that we're talking to? Alycin, is that something that you've encountered, and how have you tried to handle that?
First of all, I love policy and I love policy stories, so I actually skew the other way.
Okay.
And one thing that I think is great about reporting on housing or health is that it is a story about every single one of your readers, you know? So we all live somewhere or would like to, and we all need to go to the doctor, should have gone, or you know, so I think there's ways to tell stories that are universal. I have the privilege of writing for a tiny newspaper, which means my population is more concentrated, and housing really is a threat to every one of my readers, and so I don't really have to convince anyone of that. I would also say that if you are pitching for your story to go in the Denver Post or the Nightly News, maybe check in on your local paper. We are also understaffed, but I don't really have to go to my editor because he's busy too. So, you know, like I would encourage you to check in on your local papers and see if they can get that story going, and it will get picked up. I have people come to me, and I think it is responsible for them to be made aware of how this will affect them personally, or how stereotypes come up. I think there's enough people who don't even need it to be their story. They just need the story out there, and so it's important enough that they're involved in that. And so I am lucky, again, to work in a local community where I don't think I have to go find my token homeless person. I'm there. I know their names. They work in town. Mm-hmm. They're from Aspen. So I think a local reporter meeting these people, it's a little easier on my end.
And I do think it's important for us as reporters to help educate the people we're working with, and also the nonprofits who might be helping us that things are different now in terms of the way that things become a national internet effort against you, that things can build so quickly. You can get doxxed, you can get, just everything, and it lives on forever on the internet, as opposed to when it used to just be printed on the page, and when that was gone, people didn't remember it anymore unless they went to the library and looked at it on microfilm. Now, your personal story and your picture, and then the link to your address and your phone number and your social media page is all out there. So it's important we consider that.
So
Yeah.
I'm going to try to answer this briefly. I'm sorry, my answers are so long-winded. I just love this question because it's something that I think many of us wrestle with. We don't want just to slap a body at the top of the story, which is kind of typical, right? You throw your anecdote up at the top, and then it's like public policy, numbers, and then you put the person back at the end and tie a little bow on it, right? So I tend to approach this by telling people in advance, this is what I'm looking for, in as much detail as possible, in as much contradiction as possible, because contradiction is the human experience, and that's how we connect to other people. And these are some likely responses. People are going to tell you that, you just need to work for what you have. People are going to say, you need to go back to where you came from. And so you need to be prepared for that. And so I do have these kind of conversations in advance. I worked on a story about a woman who was undergoing eviction, and she was on the record, and the shame that she felt because she was being evicted, even though in the rest of the story I explained the systems that were in effect that could help her, her shame just overcame her, and so she became just the tenant in the story. And, and I have to make space for that. I have to make space for people's experiences. And I will often say, this is your story. You dictate the terms of your story. I only ask that you be honest with me, that you be frank. But if you have something you don't want to say or you don't want to put in print, that is your prerogative. And I think that's an approach I evolved into over many, many years of doing this.
It's very important that we all keep talking about that. Because all this has been about trying to give people their agency back, and you don't want to take away more of their agency by writing about them in order to explain the story to other people. We only have about a minute and a half left, 2 minutes. Throw this online question. Appreciate all the questions that we got from the audience. In today's world, how do you differentiate your role as journalists from that of advocates and those doing community engagement? Do you feel, let's simplify the question a little bit. Do you see yourself, Markian, are you an advocate? What are you an advocate for?
I think we've all had it kind of drummed into our brains during journalism school and training that we are supposed to be as objective as possible. But the way I look at it is our calling as journalists is to shine a light on the problems that exist in this society and to foster some discussion about solutions. So I don't think we cross into the area of advocacy. I think we try and bend over backwards to be objective, to put diverse viewpoints within our stories. I think we've sometimes gone too far to the point where we're really trying to create a false equivalency between 2 points when there's really only kind of one side to the story. But it's, I think, something that's ingrained in every journalist.
Well, I'd love to have all of you answer that individually if necessary. I encourage all of you to buttonhole all the journalists up here as you see them at the conference to talk about more of these questions that we didn't get to, other questions that came up, but we really appreciate your guys' time in explaining all these things to us and supporting the community. And just one other thing to make sure that your role in supporting journalism, if you feel it's important, is to subscribe. Subscribe to The Independent, become a member of the Colorado Sun, subscribe to the Post, subscribe to Colorado Public Radio, subscribe to the Aspen publications, pick up Out Front. I don't know if they have a membership model, but read Kaiser Health News and encourage your local publication to run Kaiser Health News. Read the Gazette and support the Gazette. It's all part of making sure that there are journalists out there to do this work that we're talking about. So Thank you again for your time. We're going to take a 15-minute break now and then come back for the CHI session.